What is composite bonding? Composite bonding means to adhesively attach a tooth-colored filling material to the tooth, more in a sense to enhance one's personal aesthetic appearance. These composite materials can be used for example, fillings in a more traditional sense, but in recent years it has been used to change the shape of the teeth, to close black triangles, to change the shape, the texture, and so on, to make especially the front teeth in the upper jaw, and to a lesser extent the front teeth in the lower jaw, more appealing. The traditional technique is based on a publication from Mr. Buonocore from 1955, and he used phosphoric acid to etch the surface of the teeth to make the surface rougher, and then add tooth-colored composite materials like plastic fillings, if you might, or white fillings, if you will, to the tooth surface. This technique has been refined over the years, but it's now, like I said, nearly 75 years old, and has been refined. So first step is you try to clean the tooth from any tartar, build up, coffee stains, tea stains, whatever is on the surface of the tooth, which is not enamel. And then you either, if it's only enamel, etch the enamel with 36% phosphoric acid to create a rough surface. If it's only enamel, if it's dentin, you etch the surface for around 15 seconds to create a rough surface with the dentin. And then you apply several liquids, depending on the system, and a primer, an adhesive, and then a bonding agent, or in case of one bottle systems, the primer adhesive and the bond in one bottle, and then light cure it, and then add the composite material and shape it in the way you want to shape it. And in the end, you use a light to set this composite material, this white film material, and this way it sticks really heavily to the tooth. It is very important to understand, and in my case, I know what I'm talking about because I had problems with my front teeth for a long time as well due to an accident as a child. So it is very important to know that, first of all, when we see other people and look into their faces, we spend around 70% of the time just looking at their eyes, and we spend around 30% of the time we look at other people, we spend this time looking at their teeth. And of these 30% of our time we're looking at other people's faces, looking at the teeth, 90% of that time we spend on the two frontal incisors. So the teeth are very, very important for the aesthetical perception of a face. And that leads to people wanting to improve their appearance, because especially nowadays with mobile phones, Instagram, Facebook, and all social media, it seems to be more and more important for people to be, or to at least appearing to be good looking. And like I said, the teeth play a very important role. And I'm normally one discarding this very easily, because normally looks shouldn't be everything in life, because I'm a bit of an older generation. But the evidence suggests that healthy and very nice teeth actually enhance people's self-esteem and make them feel more confident. So I think people have it done because they want to feel more confident. And yeah. Then the next question was how it compares to alternatives. When you have an aesthetical issue or a perceived aesthetical issue in the mostly anterior front teeth, you have three options. First option is don't do anything. Leave the teeth like they are and be happy with the person that you are. If that's not an option for you, you have to decide between either orthodontics, if the teeth are generally in good shape, you can just move them into position you want to, fix crowded teeth, and that's the end of it. The third option is to get veneers done, ceramic, thin, like fake tooth nails, putting them on top of the teeth, but that means in most cases you have to grind down the teeth. And then the fourth option, if the shape of the teeth is moderately acceptable or acceptable, then you can just change the shape of the teeth with composite fillings. And of course you can combine all these options together. You can do orthodontics and then veneers, or orthodontics and then composite fillings, or on some teeth veneers and on some teeth fillings. So you can always combine these options. And I think the third question was fixes for composite bonding. If you have composite fillings, and of course nothing lasts forever, things can break. And if they break, you can either repair it, that is easily possible. You can just sandblast the surface, reactivate the composite surface, and then add again what's missing. In the case, for example, for veneers, that's not so easily possible. If your veneer chips, you have to replace it normally with a new veneer. To judge if the composite bonding is permanent or not depends on the extent of the drilling of the tooth. If you just add a little bit composite, white filling material to change the shape of the tooth, you can easily take it off at any time. And the damage to the teeth is absolutely minimal. So that would be, I would classify that as non-permanent in the sense of that you can take it off without damage to the teeth. If you have to drill some parts of the teeth away, or if you have old fillings which need replaced, then yes, you damage the teeth a bit more. And that can't be taken off that easily because parts of the filling have to remain to keep the tooth shape. And is it when you bond the fillings to the teeth, they normally have a survival rate of something between 8 and 10 years, and then they slowly start to discolor a little bit because the composite getting a bit porous over time. And sorry for the phone. The composites get a little bit porous over time, and the problem with that is that the porosities attract tea and coffee, and then they discolor a little bit. So, but after 8 to 10 years, you can easily replace the composite fillings, and they look then as good as new. Actually, the normal lecture orthodoxy is no, you can't, because the whitening gel does not bleach the teeth. However, practical experience seems to suggest that if you have discolored fillings and you clean them with a dental hygiene and maybe airflow, then actually you have, with additional whitening, you have a chance to re-whiten your fillings a little bit because the porosities, like I said, tea, coffee tea, and smoking, staining, for example. So in my experience, in some cases, yes, it's possible to re-whiten those fillings, but generally it is very, very clear. Do the whitening first, wait a minimum of 10 days, and then do the fillings. Because the whitening, especially if you do in-house whitening or in-office whitening, the whitening consists of two effects. One effect is the bleaching material itself, and the second effect is drying out of the teeth. And the drying out of the teeth, that effect will go away again a little bit, and then the whitening stabilizes approximately after 10 days, and then you can do your fillings. So the official advice, official guideline is clean the teeth, do the whitening. If nothing prohibits the whitening, wait 10 days, do the fillings.